Welcome to episode 3 of Your Life is the Medicine. One of my favorite quotes is by Rilke. It says, "Love and death are the great gifts that are given to us. Mostly they are passed on unopened." When we talk about death and dying, most of the time the emotions that come to mind are grief, sorrow, pain, loss, and other emotions that we label as negative. However, my journey of getting closer to death, of getting to talk to people about death and dying, has been one of the most profound forces shaping my life at this point. So today, that's what I want to talk about, how we use death and dying as a teacher, as a force to shape our lives, to create the lives that we want, to create lives that are meaningful to us. And when I talk about death and dying, I'm not talking about the loss of someone we love as sort of a great shaping force, though obviously it can be. I'm talking about thinking about our own death, about acknowledging that time is limited and we don't know how much of it we get. That bringing the knowledge of our own mortality close allows us to ask what's most important in our lives and how do we live a life that feels meaningful, that feels rich, that allows us to hopefully get to the end of our life feeling like we did the things that mattered, that we said the things that mattered, that we dared when it mattered. My own journey with death and dying really started probably when I was in high school. There wasn't a lot of death that happened in my childhood, and my family didn't shy away from talking about death, but death wasn't part of our conversation very often. I grew up with a lot of animals and pets, and so death was sort of inevitable, but there wasn't a conversation about death as a sacred teacher or a sacred event. When I was in high school, 2 students in my fairly small high school died in a car accident, and it was devastating and incredibly painful for our community. And while I wasn't close to either of them, I did know them both through soccer, and one of them was the brother of one of my teammates. And so my own experience of watching grief, experiencing grief, and also about really understanding that time isn't guaranteed, that life may be short. That was my first glimpse, really. And then I didn't have a lot of experience with death until medical school. And as a student, at first I was, I think, hesitant, as many are, to be around death or to talk about death. So many of us in medicine even don't want to give bad news, right? It's hard to give bad news. It's hard to tell someone that they're dying. And yet, even as a student, I was so drawn to the people who could have that conversation and have it well, and to taking care of people as they were dying. And as a student and as a physician, I've witnessed all kinds of dying. I've seen traumatic deaths that happen entirely unexpectedly, and I've seen death that has happened over months to years where there's some understanding that it's coming. I like to say that even when we try to prepare for death, you can't really prepare for death. It feels like there's always more that we want to say or do, and more time that we wish we could have, even when someone knows that they have a disease that is going to end their life at some point. And so I became really intrigued by conversations around death and dying. And as a resident, I remember a patient who was admitted probably in the middle of the night or late at night, and there was a lot of denial about the severity of her cancer. And I remember sitting with her in the dark. She was already in her room, and I was sitting next to her, sort of talking about her medical history and, all of the things that I needed, the information I needed to collect. But really having this strong feeling that my work was to be a truth teller. And that was the word that came to me. Helping people understand in the way that I understood it, which isn't always correct or perfect, but helping people understand in the way that I did their disease and their prognosis so that they can make decisions about their life. And that's what drew me to palliative care. As I went on in my career, I worked as a hospitalist taking care of people who were sick enough to be in the hospital. And over, I felt this call to really have hard conversations with people, to really have truthful conversations about prognosis, about illness. And it was incredibly meaningful. And so I went to palliative care fellowship in order to do this, to have this conversation more skillfully, to do even better at the hard conversations. And during my time in palliative care, I have learned through these conversations so much about courage, that when you give people difficult news that the diagnosis they just got or have had may take their life or will take their life, to witness how they move forward with such courage is a profound honor. And getting to talk to people about what matters to them is also a profound honor. And the way that I have come to understand my work as a palliative care physician is in both truth telling and giving honest information, at least as honest as I understand the situation, and help talk them through possibilities and navigate really what matters. So my hope when I'm sitting with someone and having a conversation about death and dying is that I can deliver that news with as much compassion and honesty as possible, and also help them honor their grief and think about, if time is short, what matters most? When time is short, what matters most? And that is the question that has dramatically shaped my life and that continues to shape my life. So when I talk about mortality or death as a teacher, so often in our lives, we push the idea of death far into the future. Even people sometimes who've been told they only have 6 months to live, it's like we keep pushing that 6 months farther into the future. And when we push death far into the future and we don't want to acknowledge that it could happen to us at any time, any place, then we don't get to, or often we don't make the most of the time that we have, which isn't to say we should be doing the most important things all of the time. But when we think that we have a lot of time, we often tell ourselves we'll get to the important things later. We'll pursue that dream later. We will exercise more in a couple of years when the kids are a little bit bigger and it's easier. We will take that trip when there's more time or more money. We will say hard things and, mend broken relationships later. And when we acknowledge that there may not ever be a later, that death could come at any point in time, then we have to make the decision of is this something that's really important to me? Because if it's really important to me, I should begin to take those steps now. And when I was working in the cancer center, this is the question, what matters most, that really helped me make big changes in my life. I had worked as a hospitalist, and then I had done some inpatient palliative care work, and I was now working in a cancer center, seeing patients every day, all day long, who had cancer. And many of my patients would die of their cancer, not all of them. And I spent most of my time trying to improve quality of life by helping manage their pain or nausea or anxiety or depression or diarrhea, whatever symptoms they were having from either the cancer or the treatment. How could we help them feel better so that they could live the life that they want as best as possible, even during their treatment or their illness? And the conversations were incredibly meaningful. Often my role also became talking to people about when treatment was no longer working, or their body was no longer tolerating treatment, or they no longer wanted to do treatment, and talking about what end of life and end of life care might look like. Here I was every day having these profound conversations with people, asking them what mattered to them if their life was going to be shorter than hoped. And yet I wasn't able to live the life that mattered to me, right? And asking people that question, what matters if time is short? Like, I was also reflecting on my own answers, and I was clear about what was important to me, and yet I didn't feel able to execute what was important to me. I often got up in the morning, rushed to get everybody out the door, my kids, myself, take care of my animals, and then I would go to work and spend the day taking care of people and trying to build a program. And then I would leave and rush home so that I could help get everyone fed, kids, me, my husband, our dogs and horses, and then like maybe have a little bit of time to slow down or not and prep everything so that we could get up and do it again the next day. And in that time of my life when everything felt so rushed and I felt like I never had enough downtime to process what was happening in my work during the day, then I would go to bed, and there was finally space to sort of for my brain to kind of sort through the conversations. And so then I would lay in bed and sort of process my day and the things that were difficult or meaningful, and just sort of go through things. And then I would get up in the morning and do it all over again. And I was an integrative physician, integrative and palliative care physician. And yet by the end of the day, I felt so drained. I had no desire to make healthy food. All I wanted to do was pick up the easiest, takeout comfort food. I had no desire to move my body. All I wanted to do was like rest and sleep and be comfortable, which weren't consistent with my values. Like my whole life, health and wellness has been important to me. Exercise, healthy food, caring for me, being outside. And I wasn't able to do it. I didn't have the energy or the resources within me to do it because of how I was living. And so I finally asked myself the question, if I only had a year to live, is this how I would want my last year to be spent? And the answer was no. And so knowing that, then I took the steps to make a big change and leave my position and try to create a life that actually met my needs, that nourished me, that allowed me to do the work and be well. And it took a while. It wasn't easy, but it's that question, what matters to me? And if I only had a year to live, is this how I want to spend it? Those two questions got me here to where I am now. And so there's ways that we can use those questions, right? Right before I started Palliative Care Fellowship, I did a program at Zen Center in Santa Fe with Roshi Joan called Being with Dying. And at this retreat, Roshi Joan taught us this practice that I have continued to use and use with my patients and clients. And my words are probably not the words she taught me because it's been almost 10 years. But to do this practice, I would invite you to do this at a time when you have space in your life. Like this isn't a 5 or 10-minute meditation. This is, half an hour, or even more, where you really can settle into the space and the questions and really make yourself cozy. Like, make sure you're in a space that feels safe and that is uninterrupted, because you want to be able to like really drop into the experience. And if you don't feel safe or you are being interrupted, you won't be able to get there. Like, your nervous system won't allow you to get there. And make yourself cozy, right? Like, we want this to be container that really holds you and nourishes you and gives back to you. And then the questions that I remember, and again, I'm probably wording them differently, and my wording may not be wording that resonates with you, so feel free to change the wording. But we started to contemplate from this meditative space, and I usually get into meditative space by either following my breath or by paying attention to sensation in my body and really doing a body scan and giving myself a lot of gratitude. I always try to give my body gratitude and myself gratitude for showing up in these types of spaces, because we go through so much each day and our bodies keep going. And so from this place of giving gratitude for my body, of really connecting with my body, of slowing down, then asking, if I were going to die at the age of 90 or 100, what would I need to change now so that when I die, my life feels well lived or complete? Just pausing to see kind of what comes out. And then you sort of back it up. So if I were going to die in 10 years, what do I need to change today to feel like my life was well lived or that it's complete? If I were going to die in 5 years, what do I need to change today so that my life will feel that it was well lived? If I'm going to die in 1 year, what do I need to change today? And then if you really want to back it up, if I'm going to die in a month, what do I need to change today? If I'm going to die in a week, what can I or do I need to change today so that my life feels as well lived as possible? If I'm going to die tomorrow, what do I need to do today? And the tomorrow one, at least for me, when I did it the first time, was really like, there's not a lot that I can do, but I can tell people what's meaningful to me. And so the first time I did this practice, it was very clear to me that I wanted to marry my partner, that I was in the right place professionally, but that I was not in the place that was truly in alignment with myself personally, and that I needed to be brave and move forward. Recently, I asked myself these questions, and I didn't do the whole meditation, but as you practice with this, it gets easier to access the truth or wisdom. And so at the beginning, a meditative space is so helpful because we have access to deeper wisdom. We have access to truth that in our day-to-day lives we might not have access to, right? If I just ask myself the questions now, then, my mind has a bunch of things to say which may or may not be true. And so it's really about being in this deep connected place where you have access to what's true and in alignment for you. And I recently asked myself that question of, if I had a year to live, what would I need to change today? And the answer really was that I need to deepen into my work and into my businesses. And that's helpful. That resonates true. And so when you have space and when you have time, I would wholly invite you to do this, to think about what in your life needs changed if time is short. And the first step is just hearing those messages, right? Like in a meditation or in a contemplative practice, there is wisdom that comes forward. And you don't have to do all the things today, but it gives you a guide. It gives you a map of what's important so that you can start making steps to become in better alignment with yourself and with what matters to you. Recently, teacher and mentor of mine, Dr. Amanda Hansen, shared that one of the ways she uses mortality is to imagine herself at the end of her life and, looking back, ask herself what she would regret. Or would regret not doing. Either of those questions works, right? And so if I am at the end of my life and I'm looking back, what would I regret doing, or what would I regret not doing? And that can also give you information about what's important to you. And so this gift of talking about death and dying regularly, not like once every 5 years, but having this become something where you regularly bring your own mortality close and sit with it, and then you can allow it to move farther away again. The shadow side of spending too much time with death is death anxiety, or one of the ways it can show up. And for me, especially when I was confronting or being with death frequently, and sometimes with people who were my same age who were dying, is that I became at times very anxious about dying. And as a mom of 2 young kids, like, that is one of my biggest fears, is I don't want to die before my kids are grown. And from a well space, from a well-resourced, regulated nervous system space, I understand that I have absolutely no control of that. And so I can find some trust that it's going to be what it is. And my family, my kids will find their way through that if that happens. But from a place where I was less well-resourced and more anxious and not as I could easily become really preoccupied and anxious about death and dying, or about something happening to my kids, right? And so if this practice brings up intense anxiety about death or dying, or if thinking about death and dying is bringing up a lot of discomfort that feels like too much, I would really invite you to get help, whether that's a spiritual leader, a therapist, anyone who may help you work through that, because sometimes we do need help, especially if we've had some trauma with death, or something really deeply ingrained, or if we're just in a place that we're really dysregulated and it's much harder for us to regulate and be grounded. And so if this practice isn't helpful, please don't do it, and please seek the help that you need so that you can move into a different relationship in a different space with death and dying if possible. Lastly, I would say, as we kind of work with death and see death more clearly, there are so many ways that the world reminds us of death and of mortality, just even with seasons, right? Like the fall and winter as death, and then the spring as rebirth. The inhale as life, and the exhale as a small death. And so there are many ways that you can notice death or endings in your life, and bring that in as an intentional practice to remind us to live what matters, to remind us that the days do count, that we don't want days and weeks and years to go by where we're not living a life that's in alignment, or a life that really fulfills us. And so again, I just want to read this quote that I started with. Love and death are the great gifts that are given to us. Mostly they are passed on unopened, by Rilke. Having work that every day brings up mortality and the gift of being alive, and conversations about how to live intentionally. This is my spiritual work, and it has been such a profound gift to me to more intentionally create a life that really, really is in alignment with what matters to me. It changes how I show up for my husband, for my kids, and myself pretty much every day. And so I hope that you find meaning in this practice. I would love to hear from you if you have a relationship with your mortality, with death and dying, or if you try these practices and they give you some wisdom that you weren't aware of about what matters to you. And so I really hope that these are tools that are useful, and a conversation that helps you really think about what matters and think about how you create that life. And I look forward to hearing all about it.